Hello everyone, welcome back to our channel. Today we are going to learn about gluteus maximus muscle. So, the gluteus maximus is the largest and strongest muscle in the human body. It forms the bulk of the buttocks and plays an important role in powerful hip movements. Okay, first let look at the origin point. The gluteus maximus originates from the posterior gluteal line of the ilium. Ilium is there, no? It's posterior part. Okay. Then second one is the dorsal surface of the sacrum. The side of the coccyx is there, no? So at that part, dorsal surface of the sacrum, it got originated. Then insertion point, it inserts into the iliotibial tract, that's also called as IT band, and the gluteal tuberosity of the femur. Okay. So remember, origin point is two ilium and sacrum and coccyx. In the ilium, posterior part, that is posterior surface of the ilium, and that is behind the posterior gluteal line. In second one is sacrum and coccyx, the posterior surface of the sacrum and the coccyx bone. The insertion point is also having a 2 point. First one is gluteal tuberosity of the femur. Second one is iliotibial tract, that is also known as IT tract. Okay. There are more than two origin point for this muscle, but main origin point is ilium and sacrum and coccyx. So remember that it is more than enough. Okay. Now let's learn the nerve supply, arterial supply and actions and the daily activities of this muscle. So nerve supply, it's supplied by the inferior gluteal nerve, which arises from the L5, S1 and S2 spinal cord and spinal nerve roots. So nerve supply is inferior gluteal nerve. Then arterial supply, it is mainly from the inferior gluteal artery, but it also get additional blood supply from the superior gluteal artery. So remember, inferior gluteal artery and superior gluteal artery, this arterial supply. So now actions, its primary action is hip extension. Okay, so which means moving the thigh backward. It also helps in external rotation of the hip. The upper fibers assist in hip abduction, while the lower fibers assist hip adduction. So in addition, the gluteus maximus helps stabilize the pelvis and the knee through the iliotibial tract during movements. Okay. So then in the daily activities, we use the gluteus maximus while standing up from the chair, next climbing stairs, running, jumping, squatting and walking uphill. So this is one of the most important muscle of the powerful lower limb. Yep. So next part is applied anatomy of this muscle, gluteus maximus. So first is a weakness or injury. So weakness of gluteus maximus, it leads to difficulty in standing up from the chair or rising from squat, or difficulty in climbing stairs, then decreased power of running, jumping, slinting, those things, and pelvic stabilization is also decreased, then increased in low back pain. Okay. So second clinical relevance is inferior gluteal nerve injury. So it causes weakness of the paralysis of the gluteus maximus, because inferior gluteal nerve supplies this muscle, right? So this muscle got paralysis because of decreased nerve supply. So it leads to instability to extend the hip powerfully, and so many hip related problem will occur. So third one is muscle strain, that is overuse, common in runners, weight lifters and football players, because of overstretching or sudden forceful contraction can cause this strain. Okay. So next one is trigger points. Trigger points can refer pain to the lower back, buttocks, posterior thigh and sometimes below the knee also. Sometimes these trigger points may mimic the sciatica symptoms. Okay, so treated with the stretching, manual therapy and strengthening is enough. Then is postural impact. A weak gluteus maximus muscles can lead to anterior pelvic tilt. Okay, increased lumbar lordosis. So this is a main muscle for hip region. Yep. So next is special test. Why test gluteus muscle? So it is the primary extensor of the hip, right? So if any problem, you can see, you can test, no, to the special test. The first one is manual muscle test. It is MMT. position of the patient, a patient should lie prone, a knee flexion up to 90 degree. Then procedure, ask the patient to extend the hip and lift the thigh off the table, that apply downward resistance at the distal thigh or a leg. So palpation, feel the contracture of the gluteus maximus on the buttocks region. So you can grade according to the weaknesses. Then second one is active hip extension. Active hip extension, it is a test for the functional strength of this muscle. Okay, so position, again prone position, procedure, so ask the patient to lift the leg upward without bending the knee. So okay, no, not bending knee, without bending a knee. Then observe quality of the movement with any compensation. Okay, just check if the test is positive, a weakness, pain or any inability can be seen. So if test is negative, normally they can lift the leg. So third one is bridging test. So bridging test is the functional performance, again to check functional performance of the this muscle. Then position supine, in this supine with knees bent, feet flat on the floor and arms alongside the body. So procedure, ask the patient to lift the pelvis upward by extending the hip until the trunk, that is thigh, are in straight line. So hold it for 3 to 5 seconds. If any pain or inability to lift can see, that means it this test is positive. Okay, so next the fourth one is resisted hip extension test. So it is just to check a hip extension in closed chain movement. So again position, patient stands holding support. Then procedure is to ask the patient to extend the hip backward, apply manual resistance of the posterior thigh or the ankle, and observe the strength and the control. If the test is positive, they may say weakness, pain or inability to extend. If the test is negative, they can do it by independently. So these are all the special tests, some of the special tests of gluteus maximus muscle. So done everything. Now let's remember it as G max. Okay, gluteus max. So this is a powerful behind every movement. So G stands for, it's a giant muscle because it's a bulky muscle. Okay, it's the strongest and largest and bulkiest muscle. Then M stands for a movement, that is it moves the hip, right? It extends the hip, rotates the hip and also stabilizes the hip. Then A, that is assist, that is assist and stabilizes, assist in abduction, upper fibers, then adduction in by the lower fibers, and also this stabilizes the pelvis and the knee. So X stands for extension power, the main extensor of the hip. So this is extension. So G max is easy way to remember. So this is the end of today's class. Let's do some quick recall. So origin I already said by pelvic muscles, no, that is ilium, posterior gluteal line, and also originate from the sacrum and the coccyx region. Then inserted again to the femur, that is gluteal tuberosity of the femur and the iliotibial tract. Then action, again they have the power to extend the leg. Then nerve supply and blood supply, nerve supply by the inferior gluteal nerve, blood supply by the superior and inferior gluteal nerve. So this is the end of this gluteus maximus muscle. Thank you for watching. Next, see you in the next video.